On January 5th, Health and Human Services Secretary Robert F. Kennedy Jr. announced changes to the CDC's child vaccine recommendations. I spoke to Public Health Dayton and Montgomery County's medical director about what concerns they have and what this means for parents.
I'm very concerned that fundamentally this shift in how we protect kids is going to weaken our routine childhood vaccination rates and result in more infections and outbreaks of diseases that we have the means to prevent.
Dr. Becky Thomas, Public Health Dayton Montgomery County's medical director, explains this change in recommendations is unprecedented and can be confusing to parents.
Parents deserve accurate, credible information. I encourage all families to have a healthcare provider that they see for their child on a regular basis to address their concerns.
Hepatitis A and B, and including some forms of meningitis, are no longer recommended by the CDC. However, Dr. Thomas says it's important for parents to know they are still covered by both federal and private insurance.
All vaccines are still accessible. Very importantly, they're still safe and effective. We know that vaccines have prevented diseases for a long, long time. Nothing about that has changed.
Dr. Thomas adds concern for previously eradicated diseases making a return, like she's seen with measles or whooping cough.
The consequences of not being vaccinated and being infected can be very significant to an individual and to a community when you have increased spread of diseases that we haven't seen for quite some time. Diseases that for a long time became a part of our history are unfortunately going to likely to continue to be a part of our future moving forward.
Dr. Thomas emphasizes the need to talk to a trusted healthcare professional before deciding whether or not you want to vaccinate your child. We will continue to follow this story and bring you any updates at the QR code on your screen.